Male pattern baldness is characterized by hair receding from the lateral sides of the forehead in hairline and thinning in crown area, also known as the vertex. Male pattern baldness is caused by the effect of the male hormones, androgens, on genetically predisposed hair follicles. Men whose hair follicles are sensitive to the male hormone DHT start gradually losing their hair. Male hormone testosterone is converted into the androgen DHT by an enzyme called 5-alpha reductase. It is the effect of DHT that inhibits growth of new hair cells, which in turn leads to male hair loss and in many cases eventual baldness. Over time, DHT-sensitive hair, usually found at the top and front of the head, becomes weaker, finer, and eventually stops growing. However, even men who experience advanced hair loss almost always have healthy hair follicles around the sides of the head. Even though these healthy hairs are exposed to DHT, surprisingly they are resistant to this hormone and survive for a lifetime. Currently, there are only 2 drugs approved by the United States Food and Drug Administration, or FDA, for the treatment of male pattern hair loss: minoxidil or Rogaine for topical use, and finasteride, Propecia or Proscar for oral use. But unfortunately, drugs are not always effective, as they are helpful until the hair is lost. Thus, this medication is considered as specific for stopping hair loss and not for hair regrowth in already bald areas. Hair transplantation represents the only effective means of correcting consequences of androgenetic alopecia, which assumes transplanting hairs and follicles from one area of the head to another. Permanent lifetime hairs are found in good supply in most people, even the severely bald, usually on the back of the head or nape area. This is called the donor area. Hair transplantation is permanent because the transplanted hairs are already resistant to the DHT hormone that causes hair loss. They will not thin or fall out in the future. In hair transplantation, DHT-resistant follicles are removed and implanted in thinning areas on the top and front of the head.